Hi, everyone. I want to jump on here real quick again today because I have had some comments or questions regarding how do I treat menopause without hormones? Maybe there's a history of breast cancer or something like that that will basically say, hormones aren't a good idea for you. So this one was pertaining to sleep. So I just wanted to highlight some of the science and some ideas that might be helpful for someone in this situation. By the way, I'm Dr. Lori Marbus, and I'm a board certified family and lifestyle medicine physician who recently herself is going through perimenopause and menopause and have really been diving deeper into this amazing part of our lives and transformation for about the last year or so. But I have expertise more like over a decade, really regarding nutrition, lifestyle habits that will really help you maintain and promote health. And so, if you haven't already, please subscribe to the channel and share this video with anyone you think might be helpful. And I have a new landing page if you'd like to join my email list. I put out a newsletter every single Tuesday regarding some health topic that usually stems from somebody's asking questions. And I always share recipes that I am enjoying myself. So, hope you will check that out. The link is below in the description. So let me pull up my notes here real quick. Again, just wanted to highlight, I really want to say thank you for anyone who leaves comments or questions. Like I said, I do try my best to read every single answer or question, and answer as much as I can. Some ask really deep questions, kind of like this one. And I thought, there's probably others who are very interested in the same type of questions. So for this one, we really want to speak, like I said, about sleep. So this woman had a history of breast cancer, and so non-hormonal treatments are really crucial for her. And we need to think about non managing her menopausal symptoms that are not related to hormones. So let's take a little bit deeper dive into some of the strategies. First of all, we talk about lifestyle and behavioral strategies, right? So number one, we talk about sleep hygiene, consistent sleep schedule. So, really remember, our bodies have an internal clock, right? That's called the circadian rhythm. And it really regulates our sleep and wake cycles. And so, consistency will align the rhythm, promoting better sleep. Next is a relaxing bedtime routine. Activities like reading or bathing increase melatonin production, and that's the hormone that helps promote sleep, right? It says, like, hey, it's time to get to sleep, get ready. And it also reduces cortisol levels, which, of course, we understand is the stress hormone and can make it harder to get restorative sleep, especially falling asleep. And then what about your sleep environment? It's so important to sleep in a nice, cool, dark, quiet environment that really optimizes conditions for melatonin production and minimizes disruptions that can trigger awakenings. For example, as some of you may know, I had gone RVing full time in the last month. And so the area that we have, there's these little shades. They're people can't really see them, but we see the light. If we are parking under somewhere that's a street light or something like that, what we've done is actually create blackout windows. There's this little material you can place over, you can take it down during the day. And that's been very helpful because I'm super sensitive to the light. I wear earplugs, and that's always been something that I've done. So, again, just seeing what you can do to make yourself like a nice little cocoon for sleep. Okay. Next is diet and dehydration, right? We really want to focus in on, as I like to say, a whole food plant based diet. What this is, it's anti inflammatory, and it'll help so many things. When you think about sleep, one of the things that we do is we disregard our diet. Maybe we're eating late in the evening, or we're eating foods that are messing with our metabolism. So many issues that can occur. But if you eat a whole food plant-based diet, right, typically, like I said, the inflammation will decrease, and many people will have significant weight loss. Maybe their sleep apnea will also improve. Sometimes you'll see headaches improve, their mood will improve. So many things improve. They can start maybe weaning off medications that might be disrupting their sleep or making them sleepier during the day. So we're messing up with our sleep drive. So that's one thing I do want to speak about later, is really understanding what a sleep drive is and how do we increase the sleep drive. It's like putting the gas on the pedal to help us fall asleep and stopping the things that inhibit that sleep drive. So anyway, really want to focus on that healthy whole food plant-based diet. So it's fruits, veggies, beans, whole grains, nuts, and seeds in limited quantities. Of course, these are higher calorie foods, and many things get better just from that. Of course, we also want to limit caffeine and alcohol. So caffeine is a stimulant that blocks adenosine, right? So that is a neurotransmitter that builds up over time during the day that promotes sleep. And then alcohol also, while maybe initially sedating, can really disrupt your sleep cycles, particularly what we call REM sleep. And that can lead to what we call fragmented sleep, where you're not getting that deep quality sleep that cycles regularly through the night. And so if you are drinking alcohol, even a small amount, I would encourage you to stop. Next is hydration, right? Really staying hydrated helps so many things. But of course, we want to reduce our fluid intake right before bed. I'd say about an hour or so before bed, maybe even 2 or 3 if you have a lot of issues. And if you're also on diuretics, speak to your doctor about if there's other medications that you can take, or maybe in the morning, earlier in the day, that will not cause you to have to get up in the middle of the night to go to the bathroom. So just some thoughts there. Next is physical activity. So regular exercise, even as simple as walking, not only helps increase endorphins, which improves your mood, but it also helps regulate circadian rhythms. It reduces the level of cortisol, promotes relaxation, but exercising, especially too much, too close to bedtime, might cause an issue. So earlier in the day is the best you can. Remember, I would say 3 hours. Try to keep that your safe zone, right? So last meal is 3 hours before going to bed, last exercise and such, unless it's a simple evening walk or something like that that's very relaxing. So what are the some other non-hormonal treatments? So we're going to get into more like medications and some things like that. So this is not necessarily a medication, but it is something that some women find beneficial, in men as well, is cognitive behavioral therapy for insomnia, or CBT. And it basically changes your negative thoughts and behaviors that contribute to insomnia. It promotes good sleep hygiene, relaxation techniques, and then just kind of retrain your brain and body to associate your bed with sleep and not wakefulness. So if you think about it, if you wake up every morning, let's say at 3:30, your brain is almost like it's expecting to wake up at 3:30 every morning. So that may be where we can help kind of rechange that thought pattern, and that habit of waking up at 3:30 in the morning might get better. So I am not an expert in this, but I've definitely seen the studies that show that it's very beneficial. Next are medications. Now, melatonin may be helpful for some in small doses. You don't want to take too much. And honestly, I would do just enough to get you back into the regular habit of falling asleep. It's not going to be so helpful staying asleep, but that certainly could be helpful falling asleep. So that might be the first stop after you've done some of the other things we talked around sleep hygiene. Next is a medication called gabapentin. It really affects neurotransmitters in the brain, and it reduces nerve pain, which will maybe help promote relaxation. It can also decrease your hot flashes by kind of stabilizing the hypothalamus, the thermoregulatory center in the hypothalamus. So something there, if you're really struggling for sleep, medication might be helpful. There's another one called trazodone in low doses that might be helpful. I certainly use that with some of my older ladies. Again, it works by increasing serotonin, and it's a neurotransmitter that helps regulate mood and sleep. So just some options there if you're really struggling. And I would use them for the lowest dosage for the shortest amount of time till you get your sleep pattern back and on track. Now, if you're having more strict hot flashes, there are newer medications out to help treat with hot flashes. You might want to ask your doctor about that. But there's others. The gabapentin is helpful again, clonidine, some others like SSRIs. Again, you want to use these for a short amount of time at the lowest dose just to get yourself back into your sleep pattern. And it might be beneficial to actually speak to a sleep expert to see what exactly is going on, making rule out, any type of sleep apnea issues or some type of other issue that might be causing your sleep disruption. So if we want to talk about more herbal or dietary supplements, phytoestrogens might be very helpful. These basically come from like soy products. There's other foods that also have phytoestrogens, but soy have the most. When you look at breast cancer history, it's actually been shown with soy to decrease the risk of recurrence, increases survivability, and will actually decrease risk of breast cancer in those who haven't had breast cancer. So basically they bind to estrogen receptors and provide a very mild estrogenic effect without the risk associated with the hormone therapy. So things like soy, flaxseed, red clover, they kind of can help alleviate those symptoms. So for, let's say, a whole soybean, I would recommend a half a cup to a cup per day. And you'd have to do this for quite some time. You have to be very consistent, maybe 3 to 6 months to really see the benefit. Another one that might be helpful is black cohosh. Again, you want to speak to your doctor about if any of these other supplements would be helpful for you, depending on medications you're on and such. But valerian root and magnesium have been very helpful for some of my patients, especially the magnesium. Anywhere from 200 to 400 milligrams in the evening might be helpful too. And if you're having like muscle cramps in the middle of the night, the magnesium can help that as well. And then finally, I think it's really helpful to deal with the stress, right? So many of us disregard the stress in our lives. We're just like, this is just part of modern day living. But I would argue that it's not. I think mindfulness is such a powerful habit to get into, that you're being mindful at every moment that you can. That once you realize that all we have right now is this moment, the future will work itself out, the past is done, really all we have is right now. We're not guaranteed any time in the future. And when you kind of just live life in that space, things get a lot less stressful. Granted, there will absolutely be challenges in life, but you come into them walking knowing that this too shall pass. And that's usually not as bad as our imaginations can make things. Certainly there are times that things can be pretty severe, but again, you're in a different space. Let's say that you have a problem and it's quite overwhelming. If you come to the point that you accept this is the way it is, and you look at that, you come from a space of wisdom, right? So your inner voice can take over and help you make the best decision for you at that moment in that time. So a little bit of extra out there, but you might want to work on, mindfulness and some meditation practices in the evening. There's some wonderful things that you can actually do to help with that. So anyway, I hope you found that helpful. Just want to jump on and answer that question kind of in a quick way, but just give you some ideas and some things to explore. Again, everyone will be different. Some will be helpful for others, and some will be like, none of this is working for me. That's okay, but I just wanted to give you guys some ideas. So thanks again for being here, and I'll see you tomorrow.